share with you some ideas on fusion techniques for spondylodiscitis. I'll discuss a case and give a case example because sometimes you can't just do a decompression, you have to fuse as well. So I have disclosures and funding resources which are here. So there's been a couple of papers which showed that pedicle screw fixation can be done minimally invasively in spondylodiscitis. It creates less blood loss and less operative time. And the discharge and length of stay is lower, and there's less pain because you do it MIS. So we certainly have tried this at our shop. This is a recent case of mine, 65-year-old diabetic, terrible A1C 9.5, and pain, fevers, night sweats. Had MRSA bacteremia after he had his toe amputation and failed IV antibiotics. And then if you look at his imaging, what has happened is he has a ventral epidural abscess. It's actually thick and phlegmon. It's not even liquid. It's just thick phlegmon. He already got 6 weeks of antibiotics. And then the abscess goes and extends into the vertebral body. It involves the pedicle. It comes out into the paraspinal area. It's pushing the pleura over. So, and you can see it's a ventral abscess. It's in front of the cord, pushing on the cord. So in this situation, because it's phlegmon, it's not liquid, you have to do some bone work and basically approach this like a tumor. So when you do that, you also need a CT scan. So CT scan is showing that he has dish autofusion, and then he has the discitis with some vertebral body destruction, T6, T7, and then that abscess there. So question is, how to approach this MIS. So we did this case MIS. This is video from that case, and essentially we make a skin incision, but we don't open the fascia. And then through that skin incision, we percutaneously, well not percutaneous, but through transfascial, place minimally invasive pedicle screws. You can see the screw extension tab. So we leave all the fascia intact, just make small openings in the fascia. We're using navigation. Navigation is showing us, where's the lamina, where's the facet. On this side here, I put headless screws. So basically, you can use a screw-mounted retractor, MIS retractor, if there's no head on the screw. So you can attach that headless screw to the retractor, and then the retractor will basically open up one side of the spine, so you can do hemilaminectomy. I did a transpedicular approach here. I wanted to take out the pedicle. Basically, this is like taking out a thoracic disc. So we navigate, we take out the pedicle with the drill, and then we take out the facet, the lamina, hemilaminectomy, facetectomy, and then I tie off the exiting nerve root. And once we do that, you put a temporary rod on the other side and hold it with set screws so that the spine doesn't shift, and then take off the whole facet, get into the disc space. And you can basically come around the ventral epidural space and take out the phlegmon and also get into the disc space through the transpedicular approach. And then we put in the screw on the heads on the screws, and then drop in the rods. So we don't lose very much blood, as you can see here. Blood loss was not high. We pop off the screw extension tabs, and then basically you have the cases finished. Very heavily reliant on navigation to do this. And then we put some Vanco powder here because staph infection, MRSA, and also put some bone graft. So this is the CT. You can see here that we took off the facet and the pedicle. We got into the disc space. We took off the epidural phlegmon. This is the corridor of approach. Once the pedicle is gone, you can get into the ventral epidural space and take rid of that phlegmon. And then because I took the pedicle out here, I put one contralateral pedicle screw and then screws above and below. And so that was done MIS. And he had pneumonia and all this other stuff too, so we put him in the ICU. But he actually looks pretty good now. And so the MIS fusion is a safe alternative for patients who have comorbidities. You don't want a big incision, reduces narcotic requirements, and avoids prolonged immobilization. And I wanted to thank the team here at SMISS AP. I have met a good number of friends here, and I enjoyed the reception last night. Thank you so much for the kind invitation.